Good morning. My name is Peter van der Graaf. I work at Northumbria University and I'm the deputy lead for SKIM within the ARC Northeast and Northumbria. And today is a session to introduce you to knowledge mobilization. What is it? Why does it matter? And how can it help you to generate impact for your research? Let's start with a story. A man in a hot air balloon realized he was lost. He reduced altitude and spotted a woman below. He came lower and shouted, "Excuse me, can you help? I promised a friend I would meet him, but I don't know where I am." The woman below replied, "You're in a hot air balloon, hovering approximately 30 feet above the ground. You're between 40 and 41 degrees north latitude and between 59 and 60 degrees west longitude. You must be a researcher," said the balloonist. "I am," replied the woman. "How did you know?" "Well," answered the balloonist, "everything you told me is technically correct, but I've no idea what to make of your information. And the fact is, I'm still lost. Frankly, you've not been much help at all. If anything, you've delayed my trip." The woman below responded, "You must be a policymaker." "I am," replied the balloonist, "but how did you know?" "Well," said the woman, "you don't know where you are or where you're going. You made a promise which you've no idea how to keep, and you expect people beneath you to solve your problems. The fact is, you are exactly in the same position as you were before we met, but now, somehow, it's my fault." So this story talks about two communities, policymakers on the one side and researchers on the other side. And that's sort of represented in a gap between knowing and doing, with researchers on the one side who are keen to answer research questions, and practitioners on the other side who are keen to solve practical issues. Researchers like to explore the unknown, while practitioners are more interested in what works. Researchers publish papers and are assessed on the number and quality of papers, while practitioners are assessed on patient outcomes and financial efficiency of services. They write reports and are interested in reports. Researchers collect a lot of rigorous data and take a lot of time to analyze that data, while practitioners often don't have that time. They're under pressure to deliver quick wins. And researchers think often that evaluation and improvement are not proper research, while evaluation and improvement are often seen as valuable activities by practitioners. So how to close this gap? There's been various approaches developed. One school of thought is around pushing knowledge into practice and policy. So there's a finished research product that needs to be implemented into practice, and implementation science is seen as as an approach that identifies best approaches for implementing evidence-based innovation. And then there's the pool approach on the other side, where practitioners pull in knowledge from academia and researchers, looking at existing evidence to address practical problems. And this is where quality improvement comes in. They use evidence from research and other types of sources to improve the outcomes of service provision. But that's not easy. That's not always working well. And that's highlighted by these two figures. So it takes on average 17 years for research to get into policy and practice. And after those 17 years, only 14% of research evidence makes it into policy and practice. So an awful lot of research doesn't get used. We also know from research that looks into the reasons and the time lag why that is the case. And what it shows that often research takes too long to report. Academics are brilliant at publishing their findings when decision makings in policy and practice have already been taken. They're also very good at pointing out what the problems are, but not so good at what the solutions are. Their research doesn't contain any actionable recommendations. All their research simply fails to address the most pressing local issues. They have different priorities. And even if practitioners find the right evidence at the right time with actionable recommendations, it still has to be adapted to local context, or the evidence they need may not be available, or practitioners may not have the skills or to search, appraise, and synthesize the available evidence. So there's many problems why it takes so long for so little evidence to get into policy and practice. And on top of that, research evidence is only often a small piece of the puzzle that practitioners and policymakers use to solve their problems and to commission services. So there's other types of evidence like technical expertise. for instance, practical skills and experience, and also practical wisdom, which are professional judgment and values. So the question becomes more than how to blend these different types of knowledge effectively to inform decision-making in practice and policy. And that's sort of visualized in this screen, in this model, where you got push and pull on the other hand by producers who push and users who pull. And in the middle, there's exchange. So how can you create dual traffic of knowledge between producers and users and coordinate that exchange? And as part of that, how can you co-produce knowledge and evidence? And I will come back to that in a minute or later into my presentation. So there's been various frameworks and models developed over the years to look into that process of knowledge exchange. And this is a popular one, the knowledge to action framework developed by Graham and colleagues, where in the middle of the circle is the knowledge creation process, the thing that knowledge producers do. But the really interesting stuff happens in the outer circle, where knowledge is being tailored to local contexts, and that's visualized in the red circle. So adopting knowledge to local context, assessing the barriers to knowledge use in that context, and then tailoring and selecting interventions and knowledge for that particular context. That's a key part of what knowledge exchange is about. And Infuse, the Center for Translational Research in Public Health, which I've been working over the last 14, 15 years, we've developed a model to look at different steps in that process. How do you do that? How do you bring that push and pull together? And we've identified 4 steps. The first step starts with awareness raising. How do you give policymakers and practitioners access to research evidence and findings in an accessible format? For that, we've got a dedicated communication officer and various media tools, an active website, social media, to really push out information in a relevant and accessible format. But that's not enough, and that's where step 2 comes in. That's about sharing knowledge between researchers, practitioners, policymakers, and also community members. How do you create opportunities to bring them together to debate that evidence and look at that evidence and what the meaning of that evidence is for their local context? And we've developed various mechanisms, particularly events like quality research meetings, conferences, but also a brokerage service to support that sharing knowledge step. And that then leads to a further step in terms of, once they have an understanding of that knowledge and the meaning in local context, how do you make that evidence fit for purpose within that context? And that's all about tailoring and localizing evidence and knowledge. And for that, we've created embedded research posts and knowledge exchange brokers to really help with that tailoring and localizing. And that leads to the 4th step about supporting uptake and implementation. And that's looking at more structural approaches, particularly around relationship building, co-production, and capacity building to really support the uptake of that evidence into practice. And although these steps can be followed in a linear way, but they also are cyclical and feed back into each other. That's what the loops show on the diagram here, that some of the steps can feed back in earlier steps. So you move up and down these steps as you go along. As you can tell, I'm throwing a few names and concepts at you. So I've talked about knowledge translation, knowledge exchange, knowledge mobilization. So there's a lot of names being banded around related to knowledge mobilization. So what's really the name? And I guess what's happening here is something that Vicky Ward called a toothbrush problem. So there's a lot of terms being used. There's abundance of terms, about 263 at the last count. And also an abundance of models and frameworks, about 47 up till now. But the problem is that no one wants to use someone else's model. Everybody has a theory model, but no one wants to use anyone else's. So how to overcome the toothbrush problem? Looking at knowledge mobilization, these 3 definitions for me highlight the active ingredients. And the first one is simply stating it's a process. It's the process of moving knowledge to where it can be useful. The second one, that was defined by the Knowledge Mobilisation Alliance, a collective of NIHR Knowledge Mobilisation Research Fellows. They talk about knowledge mobilisation as bringing diverse communities together to share and create new knowledge in the context of its use to actively change something. And it highlights various active ingredients. It's about diverse communities that come together to share and create in the context of its use, with a purpose to change something. So those 3 elements all need to be in place for them to talk about knowledge mobilization. And then the third definition adds another dimension to that. It again reiterates that knowledge created in the context of its use, working with those who are likely to use it. And in doing so, boundaries between knowledge producer and knowledge users are purposely blurred and utilized. And that's another key dimension. So they define knowledge mobilization as the activation of available knowledge within a given context by blurring those boundaries. So maybe the question is not so much how do you bridge that gap, or how do you close the gap between practitioners and researchers, but how do you blur that gap more effectively? How do you bring the two closer together? And that requires a change of worldviews. It needs researchers to realize what practitioners value and how they can adapt their way of working and thinking to what practitioners value. So understanding that researchers do not always know best, that they can present research as an integral part of implementation, evaluation, or improvement, that they can be or need to be methodologically tolerant and reflexive on how they do research and how they involve practitioners in that. Being pragmatic rather than purist in your designs, and focusing on implementable interventions rather than ideal interventions. And being opportunistic, look at opportunities that may arise in the research process that create opportunities for implementation improvement or retrospective analysis of existing data. So how do you change that worldview? Well, partly by learning from others. We've done a study within the ARC and across different ARCs, looking at co-production practices in the predecessors of the ARCs, in the CLARCs, the Collaborations for Leadership in Applied Health, Research and Care. We interviewed various leaders from programs leading on co-production in those CLARCs. And the lessons from that have been captured in a paper that is currently under review, but hopefully published shortly. But I want to share some key findings from that paper to give you an insight in co-production as a particular mechanism and step in knowledge mobilization. So to start with the definition of co-production, if you look at the dictionary, it talks about co-production is to co-produce something, in this case, knowledge, in collaboration with others. Or to take a more formal definition by Ostrom, a process through which inputs from individuals who are not in the same organization are transformed into goods and services. So the key here is it's working with rather than to practitioners and policymakers. What we found by talking to the senior leaders in the CLARC who were working in co-production is that they practiced a variety of approaches to co-production. And they did this to relate their practices to their different contexts and opportunities. And the end result of that was related to different tensions that they've identified in doing co-production within their CLARCs. So they highlighted 4 tensions. One was around idealistic and tokenistic narratives. The second one was around power differences and lack of reciprocity. The third one was around inclusive language and communication. And the fourth one, perhaps maybe the most important one, is around co-production skills and organizational capacity. And I will talk through each of these tensions in turn. So starting with idealistic and tokenistic narratives, what the senior leaders reflected on that co-production can either be overly ambitious. You try to do too much with a limited understanding and not enough resources and time to do this. Or the other end of the scale, co-production is done tokenistic with passive collaboration and not much emphasis on empowerment, equality, and inclusion. And it often relates to a lack of clarity on the meaning of co-production, but also a lack of funding for co-production. It's not well resourced often in collaborative research partnerships. So the question here becomes how to balance aspirations of co-production with feasibility across different contexts. And that's sort of highlighted in the quote below. Tokenism talks directly to the fact that if you don't have money to do it properly, you don't do it. The second tension around power differences and reciprocity, or more often lack of, is about academics seeing themselves as experts and don't recognizing experts by experience as equally valuable, which relates back to the point about changing your worldview. And that's often because they're not giving voice or acting on the concerns of underserved communities. There was often only one-way dialogue from academics to practitioners. And there was a limited flexibility in roles and involvement, particularly of academics themselves. And that's illustrated in the quote below that. So it talks about we're good at beaming in as the experts, but not very good at saying, I haven't got all the answers. Tell me what you think might work. And it completely flies in the face of everything that academics think their role is about. The third tension is about inclusive language and communication. And this speaks to the fact that there's a lot of research jargon in academic communication, and the style of communication can exclude partners involved in co-production. For instance, formalized meetings with long documents that send everybody to sleep, a lack of accessible lay summaries for different lay audiences, and again, reports not including actionable messages that allow them to take forward the recommendations. And again, it's stated in the quote below, different people learn, communicate, and express themselves in different ways, using only forms that are common to researchers, exclude some. And the final tension is about co-production skills and organizational capacity. And this speaks to the fact that a lot of academic institutions are not teaching, recognizing, and rewarding co-production skills. So there's a lack of co-production skills among academics. And there was a bit of a debate with senior leaders that this wasn't really the best way to frame it as skills. They're not soft skills, but they're craft that needs to be learned over time by doing and takes time to develop. But there's also no clear pathway for people interested in knowledge mobilization, researchers or practitioners. The people who are most interested, junior researchers, often lack the power to make co-production a priority, while the people who have the power, the senior academics, often lack the time or the inclination to work in co-production. So there's a lack of strategic leadership or spread across different levels to support co-production in the wider organization. And that's again summarized in the quote below. So what I find sad is that the people who generally had that much more partnership engaged approach are not the ones who are seen as great academics. And I think that's a shame, because I think that's a problem with the academic system. So how to solve these tensions? What we found from the conversations with the senior leaders in the Clarks is that working through these tensions really helped them to tailor co-production practices to their local needs and existing opportunities. It also highlighted there's no gold standard, not one way of best way of doing co-production, but a variety of approaches are needed that are context specific and developed to different solutions. What is important, what are key ingredients across all these different solutions, is facilitating power sharing, inclusive language, and co-production skills or crafts, with a need for more distributed forms of leadership to facilitate power sharing between different partners. So how do you do this? How do you create a realistic narrative around co-production? As part of the conversations and the paper, we developed a checklist, a number of questions that you can ask at the start of a collaborative research partnership to think through and work through some of the tensions that we highlighted. And the first one is, what's your vision for co-production? But also, what language and communication will be helpful to share that vision within and outside your organizational collaboration? How much power are you willing to share with others? And how will you manage uncertainty and ambiguity resulting from that power sharing? What capacity do we have in an organization to support co-production, and what can we do to increase capacity or capability of existing staff and new staff? What resources will we need for this, and how do we distribute them fairly across the collaboration? And last but not least, how can we reflect on our vision, how well it's working, and measuring progress in realizing this ambition at regular intervals with our external partners? So these questions help through thinking some of the narratives, or the more realistic narratives, around co-production. So in sum, what I've tried to argue is that knowledge mobilization is about bringing diverse communities together to share and create new knowledge in the context of its use to actively change something. So that talks about the different active ingredients in knowledge mobilization. It's not about bringing or bridging the gap, but more about blurring the boundaries between knowledge producers and users. Please don't get stuck in the toothbrush problem, that there's many different frameworks and you don't know which one to choose, or you don't want to use anyone else's. Be pragmatic, challenge your worldview and learn from others, for instance, the Clarks. Co-production is a helpful mechanism or a step in knowledge mobilization, as we outlined in the fused knowledge exchange model. And doing co-production means working through a number of tensions that make it a productive process and helps you to tailor practices to be more realistic. I hope this introduction was helpful. I'll be happy to take any questions, but thank you very much for your attention, and I look forward to your questions. Thank you.